Everybody, welcome back to the channel. It's Dr. Pearlman, and today's video is a motivation because 2 days ago, actually it was yesterday, Monday night, it was Monday night, the same day that George Springer hit the big 7th inning go-ahead 3-run home run to send the Blue Jays to the World Series. I watched a video on YouTube. It was a generic piece of advice about how to get rid of sciatic and back pain. And it was ridiculous sales pitch. It was a gimmick, click me the word pain and we'll give you some online stay-at-home program DIY to get rid of your back pain, one size fits all from a 20-year-old. This is gonna be your all-encompassing how you can manage your back pain. That's right, for men over 30, 40, 50 years old that have had that recurrent back pain. And I'm not dismissing, by the way, young people having back pain. It's just nobody would give advice like this if they've ever had back pain that was discogenic in nature, that had multiple components, not just a tweak in the back that took a few weeks to heal on their own doing a few extension bias exercises. So again, another disclaimer. This is not medical advice to you. This is just the reality of what it's like to have treated thousands of people with terrible lower back pain, and myself included, who's had back pain since he was young 20s, all the way through surgery 2.5 years ago. And that's for another video. But here we go. How to manage your back pain the real way. Number one, I have this weight belt in my hand. Sorry if my head leaves the frame, but you've got your weight belt. You can get one of these like Everlast, old school Schwarzenegger looking belts. And you can get one of these for almost nothing online. And when you're working with any kind of bending, lifting, turning activity, you want to have that lumbar support. It cues your breathing, your diaphragmatic breathing through the stomach and helps when you're bearing down and have the control all around embracing rather than that loosey-goosey instability and susceptibility to getting hurt. Now, as a rule, and this should be when you're working, this should be when you're working out, especially when you're bending, lifting, moving things. And to be honest with you, there are certain people, when you go walking, that's right, walking in the day, and you feel your back is fatigued and always hurting, adding the compression, that compression, so that the disc isn't so expansive, may actually help within the tissues, controlling the intradiscal pressure to help control back pain. So that's number one. When you are doing heavy activity or even a lot of activity, wearing a weight belt of any kind, whether it's the SI joint kind of brace or a belt like that, is going to be a very good idea and highly recommended if I was your provider. The second thing, now we're going to dispel the video I saw yesterday. Here we go. This is the number one recommended exercise based off of McKenzie extension protocol. That is just absolutely nuts. Axel, get out of here. You go. Go. All right. So here we go. Right now, we have ourselves in a prone, relaxed extension bias position. I can get this as neutral as possible by simply putting my hands here and resting my head. What I just showed you, this, is gold standard protocol and the first go-to for any discogenic pain after it's been an acute flare-up. So if you hurt your back in a deadlift, if you hurt your back in a squat, if your back went out picking up the cup of coffee, this is gold standard first thing you do. Now, there's going to be a lot of people that are going to be uncomfortable like this. So here's where the terrible advice in the video to do this and to work into all this extension becomes detrimental, because the facet joints in the back and the intervertebral foramen that close off an extension often, very often, love to be propped up in sort of this flexion, cat position, and then going into like a child's pose position. Matter of fact, the other gold standard position that's talked about a lot is putting your feet up like this. And no, for you physical therapists out there, we're not talking about the dead bug, but the feet up like a tabletop with something under here supporting to put it in counter nutation and open up the disc space so that it can breathe. And then from there you would do deep breathing. The thing you want to avoid, if you're comfortable in this position, just much like the extension stuff I showed you, would be rotational maneuvers. The reason we want to avoid rotational maneuvers, even though sometimes it feels amazing, is over time, discs are going to get very damaged in what we call the annular fibers. And most of the time, when a disc is bad like that and you feel that pain and that pop, it's because the annular fibers have torn and some amount of the central part of the nucleus has begun to kind of creep through, starting with a protrusion, then becoming an extrusion or a disc herniation. Sometimes there can be sequestered fragments that sit on nerve roots. I hope this is all coming in clear. So you can look up these words if you'd like. I'll put them in the description. But you can do mild extension like this, but that's a progressive motion. Doing things like glute bridges, this is a progressive motion. So what I'm saying is you always have to find the most comfortable position for you, because doing the extension bias on the first one that I did for the demonstration purposes, because I love you all out there and I want you to not have back pain, is actually something that could hurt my back to an incredible amount past laying down for about 30, 40 seconds. I do really well when I'm on my side and I have a comfortable position under my knee and I can do glute bridges. And I like that clamshell part in here to activate the other glute. So just something like this could be that simple. And again, the reason why I started the video the way that I did is I would hate for anybody to be a victim of starting here and doing that, not having as much arthritis in your lower back, but then wearing out the disc all the same. You stand up, your back goes bad, the pain in your leg gets a lot worse. So you have to be able to do things like, I don't know what they call this position, angry cat, cow, whatever, being on all fours, I don't know. And then when you start to kind of mobilize and move into different positions and find where it feels the best, then you progress with various movements in where it feels good. And you progress with various forms of the cat-cow, the bird dog, which is the opposite hand, opposite leg I was just doing. You have to decide if being in a plank position with the stomach kind of rounded versus all fours and the stomach kind of rounded versus being in here, whether it's a plank or if it really is completely passive and then doing mild Supermans, you see. So all those words and all those little movements were me to go from prone to supine or on your stomach to on your back and picking what's actually comfortable for you in the position and then progressing mildly through it. Because the reality is, it's like if you're not comfortable sitting to standing or shifting your body around to a standing position, if you're not able to work in comfortable positions, and I mean very comfortable positions, that slightly progress through what used to be uncomfortable. You see, that's the key. It's progressive motion through what used to be uncomfortable, not, borrowing through pain. It's not just getting through a pain point, like it's got to get worse before it gets better. That's complete, utter nonsense. To say, no pain, no gain, again, that's utter nonsense. When it comes to your lower back and walking around completely crooked and wondering, if you're going to have to go to the hospital because of the pain, that's not push through the pain. That is finding the comfortable positions and working through what used to be uncomfortable slowly. And by doing a one-size-fits-all model or laying on your stomach and going into like a crazy cobra position and then wondering why the pain in your leg is getting worse, the pain in your glute is getting worse, or the pain in your back has rebounded and been a lot worse, shouldn't be something that people with lower back pain have to, go through. It should be something that is very nuanced to your back pain, your injury, and finding out those little nuances, like is it your L3, is it your L4, is it your L5 disc? How medial is it? How lateral is it? Did you know that a lot of people that have lower back pain, if it comes down to their back disc herniation, if that's what it is, that's pushed lateral, right? So outside lateral, they'll be good candidates for decompression where the strap is here and their legs are pulled that way. If you have a more central herniation, so midline, not outside, but inside herniation, that's a little more central in the spinal canal, you're actually a really good candidate for y-axis traction. So it's literally understanding these principles that all tie into how you can have a strong back, how you can get out of back pain, and how you can, recover and be able to progress. Because without it, you're just sitting, praying, and then you get so upset. Nobody has ever been in the history of mankind more upset than when I went to certain physical therapists or trainers that told me that I'd be running again, that told me that I'd be lifting again, that told me that it was my fault that I was going to chiropractic, which, by the way, managed my pain for over 20, maybe, we'll be fair, 18 years, until finally I decided to have surgery, which in hindsight I kind of regret, but again, for another video. I might even, make a video right after this, why I regret back surgery. But I think it's just so important to look at some of these positions in this video, take in what I'm saying and adapt it to you. And please seek from your friends and family the person that has helped you the most with, or helped them the most with back pain, so that you don't have to be a victim of this long drawn out thing because some influencer said this is the thing that eliminated sciatica and back pain because, Stu McGill, the most popular guy, which I love Stu McGill, has these, 3 core exercises. And if we do one of them modified, it will take care of 90% of back pain. That's not true. That's not true at all. And to be honest with you, there's a school of thought, and I'm one of them because I've lived it, that without the passive chiropractic manipulative therapy for the disc, to even reach the next barrier of exercise, active exercise, you may not ever be able to make the recovery from fair avoidant behavior due to the mechanical, intradiscal, intrathecal pressure built up within the spinal column that is causing so much pain via the sinovertebral nerve and discogenic, referral, if you will. Brain to body, body back to brain. I really have experienced it and I've seen it many times over. Once that passive part has been done by the chiropractor, there is a very good chance that active therapy and exercise does really, really well. And newsflash, even if you went to your physical therapist or your favorite pain management doc or your favorite massage therapist or your favorite trainer, whoever it was, if that passive part isn't done first, you really don't have a chance to the active part. But I digress. Do not just do some ridiculous cobra pose. Look for somebody that actually has experience and has had success managing or getting out of or healing back pain. Healing's a big word. And, be kind to yourself, give yourself time, find the routine and find the combination and patterns that work well for you, because inevitably that is all that works. All right, guys, if you have any questions, reach out. And until next time, it's Dr. Pearlman.